Hello, Bruce in New Zealand and Terry in Florida. My name is Philip Rulo with Rultract, and you had both inquired recently about the use of the Rultract and some attachments for pericardial windows. What I want to do is go over the importance of the extender bar, which is necessary for the midline incision, as well as quickly show you a couple of the attachments, which I will also include in the email, and the importance of having additional height over the OR table in the event that you have an obese patient for pericardial windows. Now, Terry, you had just asked for a quote on an extender bar for pericardial windows. Something that I want to point out is if you have an obese patient, you're going to need additional height because you may run out of cable in trying to retract the incision. So what I'll do now is show you, well, first we have an average size patient on the table here with a retraction at the xiphoid for a pericardial window incision. And with an average size patient, you can see we have plenty of cable available to continue to retract. Now I'll switch over to a more obese patient and you'll see how important it is to have additional height. Now, I do not have an obese model, so what I did was I raised our standard size model up off of the table to simulate where the chest of a very obese patient would be. And you can see here through the pericardial windows incision and retraction, you have very little cable to work with. So if you needed to retract further, you wouldn't be able to. And if the patient was larger, you would be out of cable. So what we recommend for the larger patient is a riser extender bar. You're still going to be able to extend out over the center of the table for the midline incision. However, you gain about 4 inches of height. And this is also going to be beneficial for IMA on obese patients because, again, you're gaining additional height over the chest. So here you can see we'll drop down to the pericardial windows incision and retract. And we have plenty of cable left, even if we had a larger patient. So that is the advantage to having the riser extender bar over the standard. Now, of course, you could have both, but I would certainly recommend the riser because it will work for the standard incision as well as the obese. So let me just show you the standard. Working by myself, I kind of have to ad lib. So we go back to the standard size patient. Even with the riser extender bar, we can drop down to the incision, retract that pericardial windows, and have plenty of cable, obviously, to work with. So this riser extender bar is going to work with both patients. The other advantage is to the riser, if you had a very small patient and you needed to get even closer to the chest, you can invert it and it'll bring you down closer to the chest for a small or very fragile patient. The other thing is you can move more toward the head or toward the feet of the patient if necessary by turning it sideways. I know you don't have the best vantage point there, but I believe you understand what I'm saying. So that's the difference between the standard extender bar and the riser. Bruce, you had asked about some attachments. We have a number of different attachments that are used for subxiphoid and pericardial window incisions. I'll include those in the attachment. Thank you both for your time and support. Have a good weekend. Hello, sorry, one thing I forgot to mention was a new retractor design that we have that's been used for pericardial windows as well as other incisions and procedures. This retractor would simply attach to the Rultract as well. This side would go into the pericardial windows incision. Once it's in place and the Rultract elevates it, you would turn the side rack here and you can see that it will actually open the incision by lifting and pushing the additional tissue away. So if you have a larger patient or a patient with a lot of fatty tissue around the incision, this is very useful in pushing that out of the way. So I will include information in the email on this piece as well. Thank you again for your time and support, and have a nice weekend.